Hey everybody, welcome to my seminar on why your MRI is wrong. And one of the things I thought would be really helpful is to actually have some visualization. So I'm going to take a moment here and I'm going to share my screen. And I have a PowerPoint presentation for you. Here we are. Let me get that started. And the goal of today is just to take some research and say, hey, look, this is what's going on in the back of your medical professional's mind. These are the things that we're considering, and let's figure out whether or not an MRI is right for you. And before we get started, I want to just take a couple minutes here just to let you know who I am and what I do. For those that don't know me, my name is Dr. David Harvitz. I'm a physical therapist with Renew Concierge Physical Therapy. And I am a manually trained physical therapist, which means that I use my hands to correct physical dysfunctions that I see in your body, whether it's your pelvis being a little off or out of alignment, or maybe your joints don't move the right way, maybe your muscles just have some trigger points. I kind of do all of that. And a lot of that kind of just factors into how you move and what's causing your pain. And then I, correct those problems, and most of the time that goes away. Um, in regards to who I work for, I work for myself. I'm very humbled and proud of that fact. Was able to start my business last year, beginning in 2020. Great time to start a new business, by the way. I say that a little bit, you know, a little sarcastically, but the reality is that my business is sort of a ministry masked as a business, right? My goal in my heart is to really serve people to the best of my ability and take care of people on a concierge basis. We are a self-paid practice, which means we don't take insurance, but because we don't take insurance, we're able to actually provide you a next level care. And I can kind of go into that a little bit in another video. But let's kind of get started. The case against imaging. There are a couple points I want to make today, and those are the five right there. The MRIs are mostly not accurate. They are overutilized. They increase the cost of your medical bills, which makes sense. And then it also increases fear and some anxiety, and we're going to get to that in a little bit as well. And then they also actually result in lower outcomes. And I know a lot of people wouldn't really understand that without maybe going through this little 10-minute seminar. Uh, but I want to make that point to you towards the end here. And you can see this uh, little cartoon I have. It's actually a very true statement. Whenever someone comes into their doctor, they're like, "Hey, I want an MRI." The doctor's going to weigh the pros and the cons, and the pros seem kind of silly and protective of himself, and the cons typically are all the points I'm trying to make. And so, without much further ado, I'm just going to get right into some of the research. And it's interesting because no one realizes how inaccurate MRIs really are. We really don't, even though we see something on an MRI, it doesn't necessarily mean that's what's causing your pain. In fact, a classic study done in the 90s kind of showed us that 64% of asymptomatic, that means no pain, asymptomatic subjects had some sort of disc herniation or degenerative change. That means if you have a disc herniation in your MRI study, or you have degeneration, disc degeneration, a lot of people have degenerative disc disease or degenerative changes in their lumbar spine, their lower back. If you have those things, that actually doesn't necessarily mean it's causing your pain. And how do I know that? Well, because 64% of people who don't have pain have that diagnosis. And so the question really is what's really causing your pain? And that's what I try to specialize in my practice. Um, these MRI diagnoses range from significant to severe, either disc herniations or changes, arthritic changes. And really, the conclusion that the researchers made was, hey, a patient's clinical situation must be carefully evaluated in conjunction with the MRI results. And so, what do we mean by that? That means that don't use the MRI only to diagnose a problem. We should actually consider the clinical presentation or how someone's moving. And that's exactly what we do as physical therapists. In fact, by law, physical therapists aren't even allowed to order or even interpret these MRIs. But the reason why is it's not as necessary. No one's really fought for it. in our profession to get on board with some MRI stuff. And the problem is that's what radiologists do, though, is they never see the patient. A lot of these radiologists are working from home. They'll get an email saying, hey, we've got an MRI for you to look at. Can you study it and send us back the results and interpretation? And so you may recall maybe in the past, you've got an MRI and you got the ER bill, you got your doctor bill, you got your you got your hospital bill, you got your MRI bill, and then you got the radiologist bill. Well, they're all separate people, and everybody's going to get you their bill. But the reason why they're all separated is because they're not all working in conjunction with one another. And so the physician that you see in the ER, or maybe the physician that you have that recommends the MRI, is not the radiologist that's actually interpreting the MRI. Now, in some cases, like orthopedic surgeons, they tend to interpret their own studies, but sometimes that's also in conjunction with radiologists. That being said, keep that in mind, is that the person who's interpreting your study isn't even seeing you. And I think that actually goes a long way in increasing the inaccuracies that we find in the MRI studies. So another classic study, I find this hilarious. It's not okay. It's not funny, but I also find it quite amusing because what happened with this study is that the same patient goes to 10 different radiologists in several different hospital groups in the area, and so the researchers wanted to know, well, would the MRIs, the X-rays, be similar? Are we going to get the same results? And so a 63-year-old female volunteer with sciatica allowed herself to be scanned at 10 different radiology clinics. And this is what they found. 16 unique findings or problems. So 16 different problems. But here's the issue. Not one was found on all 10 reports. However, only one of these 16 findings were found on 9 out of these 10 reports. The average radiologist made about a dozen errors, seeing 1 or 2 things that weren't there and missing about 10 things that were. And that sounds insane to me. And so what does this mean? It means these MRI studies aren't necessarily going to tell you what's wrong. And even if you are convinced that you do have a herniated disc or degenerative changes, the question is it really there? Is it really on the MRI? Is it going to be found there? Maybe it just depends on the MRI person the radiologist that interprets your imaging study. And I want to dwell on this. People don't realize how inaccurate these can be for you. And so you've got physicians and physical therapists and chiropractors making these decisions on your care based on very low quality results or low sensitivity studies that aren't really specific to what is actually going wrong. And it's hard to imagine you going to your mechanic saying, hey, listen, I took a picture of your car's engine and I know exactly what's wrong. The reality is sometimes you got to open things up and turn the car on and see really what is malfunctioning. And it's the same thing with the human body. We actually need to interpret things with movement. With my practice, the way I always tell people is, the way I always describe what I do is I fix pain associated with dysfunction. Most people who want an MRI and have back pain typically hurt more with activity. Maybe it's not directly while you're having your activity. Maybe you're out playing tennis and then you come home, it's different, and then it gets worse. But normally people bend a certain way, move a certain way, and it hurts more. Why do we want to take a picture of a movement dysfunction? It's only a snapshot of really what's going on. And so what we need to do is be a little bit more investigative with our evaluation. And so we've already concluded that the MRIs are not very accurate. But another thing that people don't realize, at least in our medical world, is that not everyone needs an X-ray or MRI. In fact, we've studied this multiple times, and for patients with low back pain, when severe progressive neurologic deficits are present, or when there's serious underlying conditions are suspected, that's when you should probably get an MRI. If you're having low back pain and it's just been bothering you for 2 years, 5 years, that's actually not an indication for MRI or X-rays. And so, in fact, I have a friend just last week tell me, "Hey, I have some foot pain and I can walk on it, and it hurts. It's like a 5 out of 10 pain, but my doctor wanted to get an X-ray." And I said, I don't know what he's going to find, because you can walk on your leg, which is a huge indicator of um, not having a fracture. And she's like, "Well, I'm just going to kind of do what my doc says." I'm like, "Hey, you do what you think's best." And we absolutely overutilize X-rays and MRIs, and a lot of that comes back down to liability, and that's not a doctor's fault either, by the way. That's more of our system's fault. And so, moving right along, lower clinical outcomes. This was one of the more interesting things I found when researching this. Early MRI without indication actually affects the clinical outcome in a negative way. And so what they found was, they said, okay, well, who gets better and who gets worse? People who get better tend not to have MRIs, and people who get worse tend to have MRIs early on in their diagnosis, um, and discovery of their diagnosis. It's quite interesting. And my personal opinion is because when we get an MRI early on in our pain syndrome, and we're like, "Hey, I have back pain, let's just get an MRI real quick." What ends up happening is that people use that MRI in order to diagnose you and put together a good treatment plan. The problem is, it's not a very good treatment plan because it's based on a picture instead of a clinical presentation, with a movement screen and a physical evaluation. And so what ends up happening is you start barking up the wrong tree. For example, you go to the MRI, you get an X-ray or an X-ray, and you find that you've got degenerative changes, and say, "Hey, look, that's what's wrong. You have degenerative changes." And so the doctor recommends cortisone injections, and it doesn't change your pain. Well, he goes, "Okay, well, maybe we need to get you into pain management, or we'll get you a TENS unit, or we'll go ahead and we'll get you a rhizotomy and all these different procedures," when really all you needed was someone to mobilize your pelvis. Maybe it's your pelvis, it's called. Maybe it's your hip. you know Maybe you've got some pain that's caused from your hip, but you feel it in your back. There's lots of problems that radiate up or radiate down. Maybe it's your upper back that's actually causing your lower back to be stressed out. There's a lot of different syndromes that are correlated to that. And so it's very difficult for you to take a picture and say, "Hey, look, let's go in this direction," when really you should use a clinical presentation and evaluation to determine what course of action you take. So when do you really need an MRI? Disc herniations, certain amount of pain, when you need an adjustment. I know a lot of chiropractors like to look at the spine from under, an X-ray, and say, "Hey, look at the curve." What about when pain, is not really relieved with any kinds of treatment? If MRIs don't help with lower back pain, what are you supposed to do? And my answer was sort of, let's go back. When do we really need it? You need it when there's some progressive neurologic deficits, okay? But going forward, what do you do beyond that? Yeah, I'm gonna put a shameless plug in here. Yeah, you call Renew. The reality is that MRI should confirm the clinical diagnosis. Most physical therapy clinics are exercise based, and that means that they don't have as much time for you. If anyone here has had physical therapy, typically what ends up happening is you get that initial evaluation that might be 30 minutes. And then you go right into exercises, and you end up being rotated through physical therapy assistants, and you're being seen as one person amongst 2 or 3 patients for one physical therapist or one physical therapy assistant, and you're not really getting that individualized care. And so what you really need to do is you need to go to a medical specialist that actually has the time to help you determine the root cause of your problem. And again, that doesn't necessarily rely on those MRIs or X-rays. You also need that person to have pretty strong evaluation skills. I will tell you, very few primary physicians will put their hands on you, other than to maybe push that gut a little bit, see how see how that's feeling. But in regards to your back pain, that's not their specialty. There's nothing wrong with physicians that don't do that, by the way. They're just not, it's not their area of expertise, and I want to make sure that's very clear. You also want to make sure someone's up to date on their research. A lot of PTs are easily led towards, oh, there's your MRI, that's what it says, so we're gonna go ahead and treat that disc that we found on the MRI. So if your doctor of physical therapy or your PT or your chiropractor, your physician saying, hey, let's see what that MRI says before we do any treatment, it's probably the wrong practitioner for you. I wanted to take a quick note, by the way, and talk a little bit about herniated discs. We have a meta-analysis here for those of you that are not really, up to date on what research is. A meta-analysis is a conglomeration of multiple studies of high quality put together and said, let's just look at this whole picture. And so that's what these researchers did in 2017. And what they wanted to know is how often do discs just heal, right? And so they followed multiple studies over an 8-year period. And this is actually what they found: herniated discs, protrusions, spontaneously deherniate. That means they kind of reabsorb and go back to normal. They heal. Your herniated disc can heal. And so what we found is that from the 11 studies shows an extremely high overall incidence of disc reabsorption. Kind of reabsorption is sort of alluding to going back to where it belongs. And what we found is 66% in patients who received conservative therapy, which is pretty much anything but surgery. So a lot of people will take, we saw these results in these patients. And the reality is that's a majority of patients who have disc herniations. It's more people don't need surgery than need surgery, which is a wonderful thing for someone who has low back pain and maybe a herniated disc. Now, one last thing to note, though, that I think was interesting that we found. This is a surprise finding in the medical world. Herniations resolve on their own with the help of therapy. And the worse the herniation is, the more likely it is to regress or reabsorb or heal. Okay. And this is done in a systematic review similar to a meta-analysis of 31 studies. And I want to make sure this is very clear. The worse your herniation is, the more likely it will heal without surgery. So what tends to happen is it's those little mini herniations that actually tend to lead towards more surgery. And actually, again, my opinion is because when it's a little something, you don't really necessarily, a little injury, you don't necessarily seek out the care that you need. You continue to do what you normally do, and you tend to continue working. You continue to work towards pushing through your pain instead of seeking out the help that you need, which actually in turn makes the changes, the degenerative changes, the injury much more solidified and reduces the overall outcomes. As opposed to if you have a really bad herniation, you're going to know it, you're going to be like, oh my gosh, my back's going to break, and you end up actually taking it very seriously. You stop doing those activities that you ought not to do right now, and you seek out the medical attention that you need, whether it is from a PT or chiropractor, maybe it is a physician getting some injections. Those are all fine things, and you actually take it more seriously, and because of that you actually tend to heal. So in any case, that is my presentation for you with MRIs and why it is wrong. I hope you got some value in this. It is my heart's desire for people to understand what they're dealing with back pain. This is a very important topic for me, especially when so many people are getting imaging studies and the medical community is mostly directing people in the wrong direction. They're pushing people into imaging and going the easy route instead of taking the time to evaluate the root cause of the problem. A lot of that, again, has to do with the insurance companies and how they kind of like to operate, but not here with Renew. I hope you found this information valuable. I hope that overall you got something out of this, and maybe next time you feel like you need an MRI, you take a moment, take a deep breath, and think to yourself, maybe I don't need that, and seek out a physical therapist, whether it's myself or another one of my colleagues in this area, in order to get the right treatment for you. So in any case, you guys all have a great and blessed day, and feel free to reach out if you have any problems or questions about the content of this post. All right.